Hosted Dr. Bouvier with Dr. and You, and you came to this video to learn a little bit more about the county CHF program that's been ongoing now for a few months, actually a little over 6 months. And we started the program to identify the people at risk, of course, and then also to help with two things: improve their quality of life, their existing quality of life, help live a full, whatever their potential is, and number two, to help them stay out of the hospital and emergency department. So better quality of life, and whatever their potential is, and number two, help them stay out of the hospital and emergency department. So we did a few things. We identified a few patients. We trained the staff by video and do a pre and post test. That actually went pretty well. Identified some interesting things. Actually changed the pre and post test up a little bit in accordance with what we learned. Then also set up a kind of a daily schedule, and we were tracking two different things, trying to make it simple, of course. So we set up daily weight schedule, and actually ended up being Monday, Wednesday, and Friday. And then a quality of life scale. And the quality of life scale took a couple of different forms. We found that using red, yellow, and green was a good way to identify how they were doing from a subjective, and trying to quantify that into an objective scale. And the yellow, red, green seemed to work very good. Green being I'm fine, doing great. Red, I mean, hey, I'm in an emergency, we got things going on, or urgently at least. And then yellow is kind of like, hey, I don't quite feel as good as I did yesterday, but it seems to work very good. What was interesting, it also took into other comorbidities, like how their gastrointestinal system was doing, how their respiratory system was doing, since everybody has comorbidities. So that quality of life scale seemed to work very good, and it seemed to correlate very well. Of course, it works well with the congestive heart failure program, focusing on PND and orthopnea, as well as just general overall feeling. So we identified, from a clinical standpoint, we had initially looked at staging, correct staging of the disease process, but also how are things transitioning? How does the stage transition? And actually, we're doing our second echocardiogram and a set of labs coming up in August, and we'll be able to see if there's any worsening, and we can really track that staging very well. It's very important in every congestive heart failure program that we've done, is to get the staging right the first time, and then also track that as the stage gets worse, so you can have communication with the family, communication with the staff, let people know as things get worse through time. I think one of the best things that we learned was trying to simplify the whole process. You know, the care plans that we have sometimes get very robust, and it gets a little carried away. I think if we really simplify things and individualize things, it seems to work very good, and we're going to continue talking about that. I've done a SWOT analysis, SWOT, strengths, weaknesses, opportunities, threats, and you can call me and we can discuss that. I think our plan at this point would be to chase a grant down. I'm going to be going to Michigan State University actually this Wednesday, talking with the grant writer, and we're going to go to the library and where the grants, where they have listed all the grants in the United States, and I'll pick up some that people have donated for the congestive heart failure program that you have up here. I see a couple opportunities here. Number one, I think we should increase the number of patients that we have. 9,000 people in our county, and probably 12 to 15, you know, in the summertime. Interesting enough, the population is not aging like you would think. Actually, they're kind of dying off, and newer, older patients aren't necessarily coming to the community. So, as far as I can tell, we've identified about 125 congestive heart failure patients, 50 of which kind of end up through a revolving door, you know, going in and out of the hospital, the various hospitals and doctor's offices. So part of this grant process is to probably change the care plans a little bit so they're more individualized, and take into other comorbidities, especially congestive heart failure, pneumonia, MI, fall risk, and then of course CHF and CAD and the cardiovascular disease that goes along with that. Part of the grant also will be identifying how can we identify these patients and who they are and where they're at, and then how do we get to them, and how does your facility kind of play a role in there, and how do we get some money infused into your operation that you're already spending, but probably not getting reimbursed for. So what I'd like to do is identify more patients, and then try to identify the things that the insurance company's not paying for, try to get that money through the grant and to support what you're doing here, which is a great thing for your community, and I really praise you on that. So, here's some of my thoughts on identifying more patients. Tell me what you think. I think we can, through the local internet marketing, we can identify people more at risk, people who Google CHF. We can take those people who are in Iosco County, whoever are asking for information on congestive heart failure, COPD, medical things. We can identify who those are through local internet marketing, and we'll do that through Google, Bing, and Yahoo. I think we should partner with local physicians, hospital, pharmacies, certainly the county paramedics. I mean, these guys know, they're picking them up all the time, so they know who the revolving door is, and we'll be able to identify those and be able to talk to their doctor about adding them to the congestive heart failure program. Then also there's sales groups out there that are kind of engaged in the congestive heart failure treatment, you know, especially some of the new treatments that are out. We can grab some of those sales groups like drug reps, etc., and partner with them. Again, this is Dr. Robert Bouvier. I think you've got a great thing going here. I think we've learned a lot. We've had some good training with the staff. Michelle here is absolutely phenomenal. You've got a great find in her. I really applaud you for doing what you're doing here. And I think we can go to the next step now and even bring more patients into the program and have us get reimbursed for those things that you're not getting reimbursed for now, which would be important in order for us to sustain this long term. If you have any questions, please give me a call, 810-610-7972, 810-610-7972. Of course, you can also call the administrators here, and they can get a hold of me as well. Thank you very much. Have a great day.